My name is Ryan Farthing, and this is my second movie review for NERB 461 Nursing Leadership and Management class for fall 2014. This time, I'd like to take a look at the movie Awakening. This movie is about 2 hours long and is based on a true story. This movie was made in 1990 and is categorized as a drama. This film is based on a 1973 memoir by Oliver Sacks called Awakening. This movie was nominated for 3 Academy Awards and 1 Golden Globe. The film follows a British neurologist, Oliver Sacks, who is fictionalized as Dr. Malcolm Sayer, who is played by the late Robin Williams. The movie opens up with a little bit of background on one of the main characters and patients in the movie, who is Leonard Lowe, who is played by Robert De Niro later in life. It depicts a school-age child in class who, during a writing assignment, begins having hand contractures and is unable to write. His muscle rigidity intensifies to where he is no longer able to provide care for himself and is in a catatonic state to where he is trapped in his own body. The movie fast forwards to 1969, where Dr. Sayer, who is played by Robin Williams, applies for a neurologist job at a local New York hospital in the Bronx. This hospital is a chronic hospital dealing with patients who have chronic neurological health problems. Now, Dr. Sayer, he does not have a whole lot of clinical experience. What clinical experience he does have is from his medical school. Most of his experience is research-based, and his clinical experience is very limited. So he does get the job and reluctantly takes it. He begins performing assessments and evaluations on these patients with these neurological health problems that he's never encountered before. Now, Dr. Sayer is very dedicated to his job and caring to his patients. However, he is a loner. He doesn't have any friends or family depicted in the movie besides the relationships he develops with the patients and healthcare team members. During his assessments, he finds out that there are some common characteristics with quite a few of the patients who are in this catatonic state, trapped in their own body. They're unable to care for themselves or perform any physical activities. He performs research studies to try and figure out if they are able to respond to stimuli. And it ends up that they are able to have these small movements or repetitive movements when they hear music, or if a human touch or a certain action, they're able to respond to that stimuli. He takes this information to his fellow colleagues, and they think he's crazy, that these patients are like this for years and years and years and without change, and they don't think that he's going to be able to find a cure for these patients. So he begins investigating further into their medical records and finds out that they all have the same characteristics of being involved with the 1917 to 1928 encephalitis pandemic. He comes to the conclusion that this catatonic state is a result of an over-intensified Parkinson's disease. He does further research with the drug L-Dopa being used for Parkinson's. He goes to a medical conference to gain further information about L-Dopa and the possibility of this medication being used for his patients at the hospital. He goes back to the hospital and seeks permission from his medical advisor to perform these medical trials on these patients. However, the medical advisor is reluctant to do so. He does allow him to perform a medical trial on one patient. He chooses Leonard Lowe, who is played by Robert De Niro. He begins giving this medication to Mr. Lowe. He uses various dosages to find out what is the right dosage for this medication. There's not a whole lot of information on this medication for the side effects that could possibly happen, so he watches over him very closely. After a few tries, he comes up with the right dosage, and Mr. Lowe awakens from his catatonic state. He is basically a normal human being again, able to function appropriately. However, his developmental stage is limited. He goes on to use the medication for these other patients with the same signs and symptoms, and it works. It's nothing short of a miracle. He's able to transform these patients that were trapped in their own body. These patients are able to experience life again and do things that they were not able to before for many, many years. He finds out that this medication, however effective that it is, that Mr. Lowe begins to start having these tics with the medication. The medication begins to not work for him. And this scares the other patients because they're afraid that, that what Mr. Lowe is experiencing could happen to them. These patients enjoy their new way of life, however, they find themselves lost because they have missed out on so much in their life. Life has gone forward and they have been trapped in their body, which causes much confusion and dissatisfaction with their life being trapped in the hospital. They are still patients in the hospital and not able to leave. The movie is a little vague at the end about how things work out. Mr. Lowe is not responsive to L-Dopa anymore. He goes back to his catatonic state and is again trapped in his own body. The movie doesn't give a whole lot of information about how the other patients have responded to the medication, and I would hope that these patients did go on to live a happy and productive life. However, the movie does fall short in depicting what happens further with these patients. At the end, it kind of goes on to say that Dr. Sayer continued the practice, and that continued research was performed to find out what medical treatment and possibilities can be done for these patients suffering this catatonic state and trapped in their own body. This is definitely a movie that any medical professional would enjoy. I hope that you've enjoyed my movie review and piqued interest in watching this movie. I enjoyed it. I hope that you have a good day. Thank you.